Welcome to our YouTube video on chronic inflammation and granulomatous inflammation. In this video, we will explore the pathology, pathogenesis, and types of granulomas and giant cells. We will also discuss various examples of granulomatous inflammation caused by different agents, and we will also solve some MCQ. So let's dive in. First of all, we have to understand what is chronic inflammation. So chronic inflammation is a response that lasts for weeks or months, characterized by combination of inflammation, tissue injury, and attempts to repair. Now let's take a closer look at the cells involved. Bone marrow produces monoblasts that mature into monocytes. Monocytes enter the blood circulation and migrate to the extravascular space where they differentiate into macrophages. Upon activation, these macrophages transform into activated macrophages or epithelioid cells. Now we will discuss about granulomatous inflammation in detail. So granulomatous inflammation is a special type of chronic inflammation. Formation of granuloma is a type 4 hypersensitivity reaction. Granulomatous inflammation is a protective defense reaction by the host, but it can eventually cause tissue destruction due to the persistence of poorly digestible antigens. Examples include Mycobacterium tuberculosis, Mycobacterium leprae, suture materials, and particles of talc. Now we will discuss about pathogenesis of granulomatous inflammation. So the pathogenesis of granulomatous inflammation involves several steps. First step is engulfment by macrophages. In this step, macrophages engulf the antigen and try to destroy it. But antigen is poorly degradable, so these cells fail to digest and degrade the antigen. Second step is activation of CD4 plus T cells. In this step, as the macrophages fail to deal with the antigen, so macrophages present the antigen to CD4 plus T lymphocytes, leading to their activation. Third step is the release of cytokines. In this step, activated CD4 plus T lymphocytes releases lymphokines such as interleukin 1 and 2, interferon gamma, and TNF alpha. Now we will see the function of these cytokines. Interleukin 1 and 2 stimulate proliferation of more T cells. Interferon gamma activates macrophages and transforms it into epithelioid cells. TNF alpha promotes fibroblast proliferation. Now we will see the granuloma definition and types of giant cells. So a granuloma is a focus of chronic inflammation consisting of microscopic aggregation of macrophages that are transformed into epithelium-like cells, that is epithelioid cells. Frequently, these epithelioid cells fuse to form giant cells, surrounded by a collar of mononuclear leukocytes, principally lymphocytes and plasma cells. This diagram shows a granuloma. These giant cells contain multiple nucleus. Now let us explore the types of giant cells commonly found in granulomas. First is foreign body giant cells. These giant cells have scattered nuclei throughout the cytoplasm. They are seen in chronic infective granulomas, leprosy, and tuberculosis. Langhorne's giant cells. Langhorne's giant cells have nuclei arranged either around the periphery in the form of horseshoe or ring, or clustered at the two poles of giant cells. They are observed in tuberculosis and sarcoidosis. Third is Taunton giant cells. Taunton giant cells are multinucleated cells with vacuolated cytoplasm due to lipid content. They are seen in conditions like xanthoma. Now let us see the giant cells in tumors. Anaplastic cancer giant cells. These giant cells are not derived from macrophages but are formed from neoplastic cells. Example: carcinoma of the liver, various soft tissue sarcomas, Reed-Sternberg cells. These are also malignant tumor giant cells which are generally binucleate. Example: Hodgkin's lymphomas. Osteoclastic giant cells of bone tumor. Example: giant cells tumor of bones or osteoclastoma. Now the types of granulomas: caseating and non-caseating granuloma. Granulomas can be categorized as caseating or non-caseating depending on their characteristics. Caseating granuloma. Examples of caseating granulomas include tuberculosis, histoplasmosis, syphilis, and coccidiomycosis. Non-caseating granuloma. Non-caseating granulomas can be found in conditions such as tuberculosis, sarcoidosis, and Hodgkin's lymphoma. Now, stellate granuloma. Stellate granuloma is a unique type of granuloma characterized by a star-shaped appearance and central neutrophilic infiltrates. Examples of disease associated with stellate granuloma include cat scratch disease and lymphogranuloma venerum. You can see this diagram which shows a stellate granuloma. Now we will see the examples of granulomatous inflammation which we have to learn. First of all, we will see the bacterial causes. First is tuberculosis, second is leprosy, third is syphilis, fourth is granuloma inguinale, fifth is brucellosis, sixth is cat scratch disease, seventh is tularemia, eighth is glanders. And also learn the etiological agent, like tuberculosis is caused by Mycobacterium tuberculosis, leprosy is caused by Mycobacterium leprae, syphilis is caused by Treponema pallidum. Like this, you have to learn the etiological agent as well. Now fungal causes. First is actinomycosis, second is blastomycosis, third is cryptococcosis, fourth is coccidioidomycosis. In parasitic, first is schistosomiasis, In miscellaneous, first is sarcoidosis, second is Crohn's disease, third is silicosis, fourth is berylliosis, fifth is foreign body granulomas. Now let's test your knowledge with a few multiple choice questions. First question, macrophages are converted to epithelioid cells by the cytokine. Option A, interleukin 2, option B, interferon gamma, option C, TNF alpha, option D, TGF-B. So the correct answer is option B, interferon gamma. Question second. The epithelioid cells and multinucleated giant cells in granulomatous inflammation are derived from which cells? Option A, basophils, option B, eosinophils, option C, CD4 plus T lymphocytes, option D, monocytes, macrophages. So the correct answer is option D, monocytes, macrophages. Third question, which of the following is not a characteristic feature of granuloma? Option A, chronic inflammatory infiltrate, option B, epithelioid cells, option C, giant cells, option D, PMN with fibrinoid necrosis and cellular infiltrates. So the correct answer is PMNs with fibrinoid necrosis and cellular infiltrates. Fourth question. Stellate granuloma is a feature of which disease? Option A, Crohn's disease, option B, cat scratch disease, option C, Hodgkin's disease, option D, berylliosis. So the correct answer is option B, cat scratch disease. That brings us to the end of our video on chronic inflammation and granulomatous inflammation. We covered the pathology, pathogenesis and types of giant cells and various examples of granulomatous inflammation. We hope this information has been helpful in understanding these important concepts. Thank you for watching and don't forget to like and subscribe to our channel for more educational content.